Here we are, another episode. Renee, what are we talking about today?
Wow, so much to talk about. The legislative session started last week and it's off and running for the first week this week after the Martin Luther King Day. So we're going to talk about, and I guess after Inauguration Day. So we're going to talk about what are the priorities for the legislature here in Iowa, and we can add in some of the conversations we've had across the country. We talked to Annette recently out of Nebraska and talked about their initiatives over there. So we're going to just do a deeper dive into legislature because this is the season where everybody goes back. So before we get into that, what's going on at the farm here in January?
Well, I thought to, kind of tie into our legislative theme is, paying a lot of attention federally of, the Farm Bill extension, another 3 months, so it appears. So we're still stuck in 2018. And that's kind of, I think, going to be the theme as we talk about legislation today. It takes a long time. And sometimes our legislators get stuck. And then we just keep doing the same thing over and over again, regardless if it's effective or not. And so as a farmer, it affects us a lot, what happens both federally and at the state level.
Right. Yep. And so for those of us that have been following along in the state of Iowa, a press release was sent out back in December that the Iowa Primary Care Association is going to be taking over the administration of, excuse me, all regions, now districts for behavioral health. And as we start unwinding, what does that mean and how does that look? So there's going to be probably quite a few legislative priorities, if I were to guess, coming up into the session. And so we know right now what was kind of prepped pre-session, but as we get into this session, I would bet there might be some other changes because those decisions were made kind of at the last tail end of December. Most associations start their planning in September, October to get those through their boards and through their associations, and people get to vote on the priorities. So the ones we're going to talk about today are those priorities that we've seen printed and published here at the end of the year that they started working with legislators about at the end of the session, before session started, that kind of stuff. But we also know, and we'll give updates along the way during the legislative session of other surprises we might find along the way. So to kick us off, Jason, why is this so important when we talk about behavioral health, specifically thinking about kids?
Well, there's been so many changes. I think of this the last 5 years, it's been confusing because there's been so many initiatives started and stopped and started and stopped. And then there's a major redesign and then it flows into another major redesign before the first redesign was done. So in a lot of ways, we've lost track of a lot of things. A lot of things that historically people understood were changed so dramatically that now it's kind of confusing to where we're at. And then when we're in flux, there's the promise it's going to get better, but we're not exactly sure where it's going to land in the end. And I think that's the frustration I'm hearing a lot right now is we're under some major redesigns and we're not really sure how that's going to end up or if it's actually going to produce the outcome that everyone promised us when it started.
Right. So for a history lesson, Jason and I have been around for all of this, and we weren't the beginning of any of these redesigns. In fact, that's been decades before we even got into the scene. But the ones that we are a part of started with redesigning the mental health system from a 99 county system to regions. And that was back in 2000. Now, well, let's think. We started in 2010, 2011. So it's been a minute. And we started way back then. And for those listening that don't know, I wanted a statewide system back then. And I had the legislature talked into voting for a statewide system back then. But then at the time, bless his heart, we had our HHS leader, Chuck Palmer, said, you can't do that, Renee. It's too big of a bite, too big, too fast, too much change, can't do it. So he then talked me into regions. And I then had to go back and resell why regions after I'd already sold why statewide, which was not the easiest sell because everybody's looking at me like, "Are you crazy? You just said we needed statewide for all these great reasons." And I'm like, okay, let me backtrack and work it back. So we started out with regions, and regions kind of started because it was county tax dollars back then. County tax dollars, where counties got to pick which counties worked with which counties. So the map was a mess. It was basically based on personalities of who was on the supervisor boards, if they could get along or not. They'd work together in these clumps and they'd create what was called 28 agreements to like just kind of enough legal to make them work together, but they still had their own dollars. Nobody shared money. And that's where we started. So you start there and then you move your way forward through the system. And to Jason's point, we switched it all over to state dollars. They bought out the county system a few years back. Then they started adding a children's system because that was added, tacked on later. And then, we brought Medicaid into the state during that time. So then Medicaid took over behavioral health. It had been in behavioral health, then it was carved out of behavioral health, but then it came back. And so to Jason's point, major initiatives in the past 10 years have been, changing who pays for things, who administers things. So to his point, we now have a new system of now the Iowa Primary Care Association is going to be the manager of this system. And so, yeah, that's a lot to take in. And we
Well,
didn't even
and
talk about the boards and commissions that all changed. I mean, wow, that's a lot of change.
well, and we thought we were going to 7 districts, and lo and behold, it's one ASO for all
Yeah.
7 districts. So maybe we finally, it took us 25 years to get to that one entity overseeing behavioral health. And so, we're there, but it was a painful 25 years to get there, I think.
Well, and to your point, I mean, off the top, just a couple of things that matter about, well, why would there even still be districts? Is there's advisory boards that are supposed to exist in all 7 of those districts. And then I'm trying to think, there was something else I thought of that was supposed to happen in all those districts. Only a couple of things though. So generally, you're right. It is sort of now statewide system, but there's this new map to what end? And so these are some of the questions we have, you have, listeners have, and we're going to be continuing to dive into this. And there's going to be lots and lots more meetings, more information coming out. And to be fair, I'm not totally sure that the Primary Care Association knew they were going to win. They seemed a little surprised when I chatted with them. And so there's probably going to be lots of conversation. So what I do know, what's not going to change? We're still going to need behavioral health providers. We're still going to have to do the work that we've contracted to do. So those CCBHC contracts with the feds still are in effect. They still will happen. People will still get services. The things that that we've all contracted in our world to happen has to still happen. So everybody still has jobs. Everybody might be trying to jump ship, but we have work to be done. Kids still need to be served. Adults still need to be served. We still have more needs than we have help. All of those things stay true. So it's hard because everybody's like, oh my gosh, things are changing. But the basic, when you get down to the person, the kid, the parent who needs services, that doesn't change. And so we've got to figure out how to get our heads out of those clouds and get back to what's the point. So
And
Jason, talk to us about what's going on. You've seen some changes across other states too. So lots of change across the nation. It's not just us. The whole system is changing.
Well, and that's where we do need some legislation to support all of these changes. And I think that's part of the challenge is when we're in all of this flux, it gets harder for our legislators to be able to clearly identify what is it that we need to do and how do we support this process forward. And, we've seen departments of health and human services push back really hard against some legislation in other states. And that's been fairly detrimental to providers and some of those folks who need to provide those services. And so, I think it's that balancing act. There's checks and balances involved here. And so, I kind of go back to in the state of Iowa, we've had a lot of focus on kids, and that's kind of gotten lost in all of these redesigns and reshuffles. And there isn't as prominent focus on kids as I think we would have liked to have seen from a lot of other positions and folks that I talked to. And so thinking about how do we get back to having some of those specialty focuses, even in the midst of all these transitions.
One of the things that I'm looking forward to with primary care being at the helm, you and I have preached this forever, but behavioral health care is healthcare. And now we get to put our money where our mouth is, right? It's like, here we go. So for kids, primary care is 100% where it starts for behavioral health because they're with their primary care docs first where things aren't quite right. And almost no one as a parent goes in thinking I have mental health issues with my kid. Nobody. They're going to their regular checkups for their regular milestones and something's not quite right. And that's that regular doctor on that front line that has those first conversations. So there really is a huge opportunity here for kids to be cared for holistically from the get-go and get those services connected. Now, we all know it's going to take a minute and it's going to be kind of bumpy to connect all this, but I like the idea of where this is going because it's never made sense that behavioral health and substance use were carved
Right.
out separate from a real person. So because primary care is at the focus, I think we have the opportunity now to really do that. But to your point, you're going to have to make sure it doesn't get lost in that. And it's not just primary care for kids. They need those specialty services above and beyond. And how do you make sure there's a pipeline there so that you can get from your primary care doc to those specialists? And I think it's possible, but I'm also an optimistic person and I end up very optimistic about things that just don't happen. So trying to be realistic in this situation, but there's reasons why this connection made sense, even though those of us in behavioral health kind of like, what is happening? So I think big picture, there's some things. So one of the things that's happening in a lot of states are changing these 1115 waivers. And
Yeah.
Jason, talk to us about that. You've heard a lot about this. What's going on with 1115s?
Well, it's not just 1115s. We're seeing so many things in flux right now around Medicaid, around how states are administering Medicaid. There's been a real scramble over the last 2 years, really, as we went through the pandemic. There was kind of a loosening of some things federally, and so we've seen a huge transition. We've also seen a huge transition here in Iowa. We're undergoing kind of in all areas of our Medicaid system kind of a reshuffling of how things are done, what the oversight looks like. For example, the Hawkeye Board and the Medicaid Assistance Advisory Council have combined. There's some legislation cleanup that has to happen this session for that. There's still a lot of questions about what does that look like. All states now have to have what's called a back, which is basically members of Medicaid have to be able to provide feedback and have a formal way to do that. And so all of these new boards and commissions, kind of councils, have to be propped up. There has to be kind of a way for individuals to share that information. And it's really confusing. I'm kind of in the middle of some of it. And I'm having a hard time understanding kind of what the vision here in Iowa is of how are we going to get there? What's it going to look like? What are the rules that we have to have around that? And what legislation has to be amended in order to
Right.
do that, because those things are codified, that there has to be a Medicaid Advisory Council. That's part of the federal rules of being able to
Yep.
administer Medicaid at a state level. And so a lot of that has to get done this session to make sure
Sure
that
does.
we're in federal compliance.
Sure does. Yeah. And for those that are listening that are like still maybe mad or worked up about the changes of boards and commissions, let me give you a little history lesson on that. So the thing Iowa did well or poorly, depending your perspective, we had tons of them, but a whole lot of them didn't lead to actual places where people could make change. So you felt like you were included on lots of councils, lots of boards, lots of things, and we were very inclusive. We had that down, but all of it turned into reports that went kind of nowhere. For shells for many years, clouds for current, and it didn't really change or drive legislation. So you had these really well-meaning people sitting on all these boards and commissions who thought they were making a difference legislatively or policy-wise or rulemaking-wise that just really weren't. And so it was kind of a figment of people's imagination. They thought, I was appointed to this board, but it wasn't really a working board, et cetera, et cetera. So in and the other piece of that was the amount of staff time it took for all of the government. And the size of our government has gotten smaller ever since Branstad came back into governorship the second time, of reducing just the total number of people working for state government and the scope and size of state government for a state of our size. So part of that also, a big piece of it was like, how much time are staff doing sitting on these boards and commissions that really weren't making an impact? So what they tried to do when they reformed that was to keep the boards and commissions that really, one, were required by federal government, to your point, but two, the ones that really did make a difference, and then have advisories to those boards so that you really did have that better funnel to actually make change. So people sitting on a board could really impact differences. So this was reasons behind it. But to your point, if I think I just saw an article in the last month or so where not all the positions have been filled for various human services commissions. And so, it's supposed to be 11 members on a board and only 8 are showing up. And there's all these various gaps where people aren't getting appointed. So there's a lot of, to your point, disconnect of what's supposed to happen. So it's even more critical now, in my opinion, that if there's less number boards and commissions, then you should be full of people who can serve it because now you have it's a more critical board because of how it's structured. So it's unfortunate that they're still struggling trying to figure out like representation. That's got to be really hard.
Well, this is a good thing to point out to people is any of us can serve on those.
That's right.
You fill out an application on the governor's website. You say what you're interested in, what your background is, what you would like to serve as. And pretty much if you go to that volunteer website, they'll probably find a spot for you if you really want to do that. And so, that's part of our civic duty, is to go and participate. And so if you're interested in something, you can go and we can find that link and throw it in the show notes as well. I think, and I know the process here in the state of Iowa, but I think pretty much every state, there's an open way to go and volunteer to be on these things and learn more about the details. And so
Well, and
I
as
do
you know, not
encourage,
everybody
yeah,
volunteers because you may be on it for a very long time. You may continue to get
yeah,
reappointed
yeah,
because
yeah,
people aren't
even
stepping up. And so you may end up
right.
kind of stuck on a board that you can't get off of because other
I
people aren't taking that time. And you're right, that's really important. And now that they actually are, like I said, funneled and connected to change making situations, it's even more critical that we have people's voices at those tables and hear what's being said. So the next part of today, we were going to talk about some legislative agendas, some of the issues we think we'll see in this legislative session that people are talking about. So we've got a list, and the show notes are stacked for you today, but we have NAMI Iowa, their legislative agenda. We're going to have a group called CAMI for Kids, and I'll work through the acronym. It's Children Association for Mental Health in Iowa for Children. So it's talking about mental health in Iowa for kids, and specifically at kids. And that's more of an association group that's led by Blank Children's Hospital and a coalition of others. And so they have pulled together all kinds of interesting people and have an agenda. Coalition for Children and Families is a second advocacy group that has that. IACP is the Iowa Association of Community Providers, and they've got a really cool list. And the last one I'm attaching just because I want to talk specifically about 1115 waiver in a minute, but it's the Iowa State Association of Counties, and specifically their sheriffs and deputies who have been very vocal about behavioral health, and some of the changes that have been made through this time of lots of change did not really fix some of the issues that they had. And so they're back around now saying, hey, this doesn't really fix this. Sheriffs and deputies and police are stuck dealing way more with mental health than they're trained to do or in their comfort zone, and want partnerships with behavioral health. And so it's great to have them at the table. So they're included here. But Jason, when you look through all these legislative priorities, do you see any themes, any topics you think are going to come up?
I do. And I mean, one of the themes is stuff is really high level right now because you really can't dig into the details because it's so fluid.
Mm,
As we went into even the beginning of this session, there's still so many questions about the redesign, what it looks like, and what's going to happen on July 1st. And so some of that, because it's fluid and in flux, there's not a lot of detail this year. And so really it's looking high level. We see a lot of themes on 988 funding, right? Like how are we going to make sure we support the local 988 hotlines? And then kind of the difficult part of that question is what happens with mobile crisis because we're in the
mm,
middle of the transition to districts and that has huge implications on those areas that never did implement mobile crisis. And
mm,
so, there's just a lot of questions about what does that look like. There hasn't been a lot of information to date coming out of DHHS of guidance. It's been we're going to build it as we go, has been a lot of the mentality that we hear. And so thinking about that, we know that in the past, last year, a lot of stuff was focused on co-occurring and how do we merge mental health and behavioral health and substance abuse. Well, that's really happened, right? The departments merged. We see that now with the ASOs of managing the block grants together, all of that moving forward. And so, we some of those things I don't think we know yet. The other common theme, I think it comes down to kids, school services. How can we better support services in schools? I think the level of violence that we see, not just nationally, but in our own state, really makes us take pause and think about what are we doing to support mental health in our schools. And that's all K through 12s. And so, what exactly is going to be done in that area or support in that area, I think is a huge question mark. That's not really addressed thoroughly. And I think we need more guidance on that.
yeah, I do agree. So one of the issues that I haven't seen as a legislative agenda, but there are some key people pushing it is for Iowa to get a new 1115 waiver, which for those that are working within government that are pushing all of these changes and agenda items and all trying to keep all the balls in the air, they're just like, that's an overwhelming thought for them. And so there's a couple of things just on the national front. I had an update from Director Garcia regarding 1115 waivers and the change. This is inauguration week. The change at the federal level of government may very well impact the future of 1115 waivers, not just whether new ones will be approved, because this is all considered expansion of Medicaid. But if you think about the change in the direction at the federal level, expansion of Medicaid's probably not the highest on the list. And if
Well,
they go to trying to reduce budget at the federal level, 1115 waivers are way at the top of the list of things that could get cut. And so
well, and
there's that.
and let's talk about the three that are the biggest three right now that most states have gone after or are trying to sort out. Now,
Mm-hmm,
Iowa isn't included in these, but you had the social determinants of health
mm-hmm,
expansion piece. You have
mm-hmm,
the Medicaid pre-release coverage for individuals who are incarcerated, which has been
mm-hmm.
very popular for a lot of states right now. 14 pending states as of mid-December for that one, right? And then the final one would be that continuous eligibility for children. And so we've been hearing more about that in the news of that handful of states who have moved toward that multi-year continuity so that children don't drop off of the rolls, that they have Medicaid to ensure their health outcomes through those
Yep.
formal
And
years.
the one in Iowa that's got the most momentum is actually the one on incarcerated individuals. And so if you were to look in your show notes and look at what the State Association of Counties is looking at, they don't want when people go incarcerated into county jail for their Medicaid to drop off. And so right now that's part of it because then any medical that's required in county jails is on the county to fund it. And so, but to do that, it also changes prison. And then you'd have to predict who would be released at the 30, 60, 90-day marks, which in prison, when we are an indeterminate state, is not possible. And knowing how long somebody's going to be in jail, not always possible. So there's a lot of detailed what in the world if we go that route. So instead of going out at that direction, we're been working on fiscal notes and education for legislators who are interested in the conversation. The biggest piece that people don't understand about 1115s are they are mostly cost neutral to the state. So you have to give up things in order to get things because you don't just get a whole windfall of new Medicaid dollars and you can't supplant. So what you're currently doing for children in that particular waiver or for incarcerated individuals, none of that money supplants any of that. So you'd have to go above and beyond. And in many, many ways, our current waivers are very rich. And so there's always this back and forth argument. Well, if we open the waiver, what would we lose in exchange? And that's a real thought. And so people out that don't understand how waivers work think, oh, we'll just add more stuff, which sounds awesome, but that's not how it works. And so,
And
and in the big picture, just to finish my thought on what's going on federally, FMAP, which is your federally matched rate for Medicaid in general, there's very good chance that we end up on the shorter end of that stick where the state becomes much more responsible for the heavier load of Medicaid. And again, we already have a huge budget shortage. You'll have seen in the governor's budget and others at this point, for Medicaid because we were backfilled with those federal dollars and now that's gone. So we're already short. So when you start thinking about waivers, it's just a bigger picture than a lot of people think. They read what the benefits are and think, oh, we need a new one, but you don't understand how much it costs. The ones that you talked about that are pending, there's 3 to 4 year waits just in the pending process. It takes a year or two to create the application. It's 3 to 4 years in the pending process before you're approved. And there's nobody, especially in the incarcerated one, who has any results yet because there's nothing actually implemented for us to see if it worked or not. And so as a state trying to we're like, oh, well, California did it and there's 10 others, but nobody's implemented yet. So nobody can prove there's cost savings or nobody can prove that it's better care. There's two sides of that story. So
and
we'll be much more ahead on this, but you might see legislation this session from not just
well,
us, but many other states
right.
saying, hey, let's do 1115.
And let's not forget, we just changed a bunch of our waivers, right? We
I
just
know.
were
Yeah.
approved and have a huge change that we haven't seen that implemented yet. That
No.
just happened last July, that we have a
Yeah.
whole new set of waivers here because we did away with a bunch of stuff that was legacy and
Yes.
have transitioned, right? That's one of the parts of the redesign as we talk
That's right.
about reimagining what DHHS looks like. And so let's not forget, we're in the middle of a huge lift that we don't even know what that looks like yet. And so to
I
even be
agree.
thinking about adding some of these other things is kind of mind-boggling, to be
It
honest. I mean,
Right. And so the state, as employees of the state, we don't want to look like we're saying no. But at the same time, it's like, wow, can you realize where we are in the process of redesign of lots of things that adding one more big project is may not be the smartest idea. And it's not that they wouldn't do it or couldn't do it or do a great job doing it, but we kind of need some time of not doing new projects to settle in and see how some of this design has worked, to your point, and get into the details to maybe create some detailed legislation for detailed fixes. But we can't get there as long as we keep doing the 30,000 foot, the 30,000 foot, the 30,000 foot over and over and over. You can't get into the weeds and see if it's actually working on the ground. And so that is scary because you could have some gaps and people could miss the services they need.
well,
And kids and
I
parents, they need it today. They don't need your
that's
redesign. They need help now.
and I think that's absolutely how people fall between the cracks is because
Yep.
we never really evaluate the outcomes of the change, right? If we're always changing something, then you can always point fingers at something different for why we're not to where we said we would be by a certain time frame. And so I do think that systems need time to adjust, and that's natural. Systems do need to be pushed or they get lazy and they don't do what they're supposed to do. It's finding the happy medium. The constant change doesn't necessarily help folks. It doesn't help providers. It doesn't create a system of care that makes sense. And so I really am hopeful that we can accelerate some of these changes, get some stability into the system, and then evaluate what do we need to do, what do we need to grow, what do we need to add on that makes sense.
Yeah.
So
That ties
much.
right into the podcast we did at the end of 2024 about how to blow up a plan, not evaluating.
That's
And
right.
we're going to talk about more about that in our next session too, about evidence-based and making sure you actually look at the data. We're going to be talking about that next week. So it's right in the theme. But before we go today, I have a recovering politician self-care policy of the week. And this is absolutely because I'm a recovering politician. So what I'm going to give you today are 5 tips plus a bonus of surviving and advocating in the legislature. And you might be thinking, well, that's kind of crazy. But let me just tell you, lots of you listening might want to go into your legislature. Let me give you some hot tips. Tip number 1, avoid all pastries. Do not eat one, because once you eat one, you're going to eat 7,000 pastries because they're there every single day for every single holiday, every single birthday, every single, just make a policy off the top, don't touch the pastries. You'll appreciate yourself come spring break and summer. Second, number 2, bring your own hand sanitizer. Use it. Goes into number 3, which is don't touch those handrails. No, don't touch handrails, buttons, doorknobs. No. Do you know how much walking pneumonia is in the legislative building? It's public, and you cannot keep it possibly clean, the number of people in the building. So just don't touch those things. And number 4, take advantage of some online options. You don't have to breathe all the air. There's people who think they have to be there day in, day out, and morning till night. You don't. Things don't move that fast. So you can take advantage and just breathe some clean air and avoid that. And number 5, don't start drinking in excess. It's a long season. And there's so much free alcohol available too. If you go to all of the after parties and the afternoon receptions and all the things, they're going to give you ticket to drink. Before you know it, you've drank way more than you wanted to, more calories than you intended. And so the bonus tip is it's a long season. So think about how to take care of yourself. Start out taking care of yourself, taking breaks, get out of the building, go on those walks. Don't quit your regular self-care routine, because I did this wrong and ended up in chronic health issues at the end of my time in the legislature. So you've got to look at this differently and make sure you stay healthy first, because you're no good in that building advocating or anything else if you don't take care of you. So, Jason, do you have any thoughts on self-care? I don't know. Are you going to hang out in any of these capitals this year, or are you just staying away from Capitol buildings? What are
I
you
don't
thinking?
know. Working with you, I try to avoid Capitol buildings. It seems
You,
like I get drug into this one here locally from time to time. I think your tips are spot on though. Like you have to be patient. And we need to just bring some rational thought processes sometimes to this, and we don't want to see legislation based on emotion. We want to see
mm,
legislation based upon some data and results that we know is going to impact and be best for Iowans. And I think that's the difficult part, right? And so if we get caught up doing this for the wrong reason and we see legislation for the wrong reasons sometimes, it can be very frustrating. But I agree with you. If we can do it from afar, we should stay from afar and educate. And the biggest part of advocacy comes from meeting with your legislators all the other times of the year
that's right.
because that's far more impactful. It's face-to-face meetings in other parts of the season, in September is probably the best time to advocate for something that matters to you. And so be thinking about next year. It's not about going to the Capitol while they're trying to work because our legislators are bombarded. And so, just keep in mind that it's not about receptions, it's about building a relationship and asking the right questions.
Agreed, agreed. So today we talked about legislative priorities for 2025. And there's just a lot to think about, right? We're in the middle of a changing federal administration. We're in the middle of just a lot of change in Iowa for lots of different systems at the same time. And so we don't have all the answers for you of where this is going to be. You're going to have to sit back and be patient. I would not lobby for another big system change right now. That's my tip. We have plenty of things changing, and we're going to want to hold people accountable to make sure that the changes that we've already implemented are working. So if you had any place to stick where I would stay if I had a pick on what I would do for the legislative session is holding people accountable to doing what they've said they've already were going to do, making sure things already work the way they say they're supposed to. That's really, really important. And so getting some of that data about, okay, is this working or not? That'd be the place. But we have lots of lists for you today, and our show notes are just packed with looking at lots of information. Hopefully that'll help you get kicked off correctly for your legislative session. We'll see you next time. Thanks, everybody.